In this episode of Revolution Report, we'll be discussing the broken healthcare system and talking about universal healthcare as a viable solution that's good for the American people and the economy.
Before we get started, we wanted to let you all know that on our website, handballcourtradio.com, we now have a way to donate to the station.
Whoop whoop.
We fund the station with our own money, and if you appreciate our content and the work we do, we'd really appreciate any donations to help us cover our operating costs.
And we completely understand that the economy is in a very, very dire place right now. And if you're not able to donate, we still love and appreciate you.
Sure do.
So now, let's get into the episode.
Let's do it, Diva.
This month, in the spirit of Pride, we wanted to discuss topics that are relevant to the queer community. And access to healthcare is a huge issue facing the community as well as the majority of Americans.
It's no secret that the existing healthcare system in the United States isn't working well for most people here.
No, it is not.
If you're not lucky enough to get it provided through your work, there are high premiums, exploitative practices, and outrageous prices for even the simplest of visits to the doctor.
According to the Organization for Economic Cooperation and Development, which is a coalition of 38 countries, including the U.S., that are nominally democracies with free markets, the United States has a pre-COVID mortality rate from treatable causes that was over a third higher than Canada's rate and double France's rate. And that is despite spending double what those two countries spent on healthcare.
The current system isn't designed with people's health as a priority. It's set up to make the most money for the people at the top, all while providing care that is no longer the best in the world. It's another example of how the consumers suffer while the elite profit.
Ooh, yeah. On top of all of this, the healthcare infrastructure is shrinking. With more and more hospitals closing at record rates, less hospitals means further distances to travel for care, fewer professionals working to provide that care, and increasingly stressed employees stretching themselves thin to help people in need.
Yeah. And in addition to hospital closures, there has been a rise in hospital consolidation, meaning that hospitals and healthcare systems are merging to become one. This consolidation eliminates competition, thus getting rid of the basis for the ideology underpinning the argument for privatized healthcare in the first place.
Ugh, exactly. If there's less and less competition, that means that there's no incentive to keep prices low for consumers. In fact, studies have shown that prices are higher in areas with practically no competition. So instead, prices rise while people have fewer and fewer options.
And, frustratingly, while the number of hospitals shrinks, the money they bring in continues to grow. According to Forbes, the 40 largest healthcare systems own around 1/3 of all emergency and acute care centers in the United States, and the top 10 own around 1/6. And those top 6 bring in a combined $226.7 billion in patient revenues, which is absurd.
Another fact that is also frustrating is by 2017, about 2/3 of the hospitals in the United States had been required by a chain. Communities are losing their local independent hospitals, and the citizens have to pay the price for corporate greed.
To add even more insult to injury, no pun intended.
Let's be honest, there was pun intended.
Girl, you're exposing me. It's
I
Pride
love you.
Month. This
I
is
love you.
homophobic.
I love you, Diva.
I love you too, Angel. So, to add even more insult to injury, yes, pun intended, it's not like the care provided by consolidated locations is better than the care elsewhere. It just costs more. There's no incentive for innovation and improvement because competition is decreasing, so care doesn't improve while costs continue to rise. And while costs continue to rise, our life expectancy continues to decline. We currently rank 62nd in the world for life expectancy, which, for a country that claims to be the greatest in the world, is a tragedy. And we rank first for healthcare spending per capita. So we spend the most to not even get the results that other countries do?
This is ridiculous. And as you all are probably thinking, and us included, something has to change. Why can't we provide universal health care in the United States? Clearly, the system we currently have isn't working the way it was promised to. Everyone can agree to that. And other countries provide models for how universal healthcare can work, including our northern neighbor, Canada. Hey, Canadian listeners.
We love you.
It's not impossible, despite what the corporate overlords in this country want you to think. But they're selfish and don't care about the American people as long as their pockets get lined.
Speaking facts. Now, let's actually talk about universal healthcare and debunk the biggest myth surrounding it, that it would be bad for the economy. In fact, the opposite is true. Universal healthcare would be good for the economy, and we're here to tell you why.
Absolutely. For one, universal healthcare would boost the labor market. And not only for healthcare workers. With universal healthcare, employers would be able to reduce their costs by not having to provide healthcare to their employees, freeing up money to instead use to boost salaries, which is something we all want.
Absolutely. And with healthcare eliminated as a concern for everyone, workers would then have more agency in the job market because companies would have to compete in other ways, like higher salaries for the positions that they want filled. Companies would have to make their workplace appealing to workers, instead of workers having to rely on their employers for vital healthcare, which reduces their agency.
There would also be an increase in jobs available. With universal healthcare, tens of millions of people who aren't currently insured would be, which obviously means that more jobs would be created to meet the needs of those millions of people. There would need to be more healthcare professionals like doctors or nurses. But there would also be an increased need for people working in customer care, administration, etc.
And, as we know, more jobs available means more money being spread amongst the people, which is good for the economy.
Yes.
Plus, another economic benefit of universal healthcare is that small businesses looking to expand would no longer have to worry about healthcare costs for employees, which would encourage small business growth and development.
Which we love.
Absolutely, support your local small businesses.
There are clearly many economic benefits to universal healthcare. Now, let's discuss the benefits of universal healthcare on a social level. All humans have a right to health, despite what people at the top might believe. But with existing power structures in this country, not all Americans have equal access to the ways to be healthy.
And that is unfortunately so true. Systems don't exist within a vacuum. And so that means that factors like race, gender, and economic status affect healthcare access. According to the Johns Hopkins Coronavirus Research Center, the United States had one of the worst COVID mortality rates in the world, with Black, Indigenous, and low-income populations disproportionately affected.
Clearly, our current healthcare system just reproduces existing power structures. So how would something like universal healthcare help make access to healthcare more equitable? Let us tell you.
Because economic status is the largest determining factor in access to healthcare, a universal healthcare system would not only expand access and lower barriers to receive healthcare, it would also help reduce income inequality.
Something that the people at the top don't want the majority of our citizens to know.
Yeah, they really don't.
A universal, publicly financed healthcare system would reduce costs for the vast majority of Americans while removing subsidies for the people at the top. By ensuring that the wealthiest Americans are contributing according to their means and thus reducing costs for everyone else, A universal, publicly funded system would help reduce income disparity by enabling most people to take home a larger percentage of their wages.
Exactly. And with reduced income disparity comes a whole slew of benefits for society, from poverty reduction, enhanced upward mobility, strengthened social trust, and even reduced crime rates. The majority of crime is motivated by economic hardship, and with reduced income disparity, fewer people will be in conditions that create incentive to commit crimes.
At the core of our discussions this episode is the belief that healthcare is a human right. No one should go without the medical care that they need because they cannot afford the cost of life-saving procedures or medication. People shouldn't have to choose between life and hundreds of thousands of dollars in debt.
Yeah. The fact that between 36 and 41% of American adults have some form of medical debt, according to the National Institutes of Health, is shameful for a country as supposedly wealthy as the United States. But almost all of that wealth is hoarded by the top 1%, which is a total of over $55 trillion.
Ugh!
Yeah, trillion dollars. Now, imagine if that top 1% contributed to a universal healthcare system proportionally to their means.
What a thought. Just contribute. So, as frustrated as I believe our listeners are, and they can tell that I am and you are,
Yes.
what can we do to make universal healthcare happen? As always, you can contact your representatives and let them know that universal healthcare is a priority to you. We'll include a resource on our website, handballcourtradio.com, to help you find and contact your representatives if you don't already know how.
And make sure that you hold your representatives accountable. Don't let them think they have a passive constituency. Make your voice heard if they aren't upholding their promises to advocate for you. Also, this is an election year, so make sure that the candidates running for election know that healthcare is an important issue for you as a voter.
Absolutely. Make politicians take stances and hold them to what they say. And if you're able to lobby your representatives in person at town halls or other methods, we'll share some resources from Healthcare Now for effective strategies on getting them to listen and commit to stances.
We absolutely will. And for people who don't currently have health insurance, we'll share some resources on our website for ways to get free or low-cost healthcare. We recommend checking out local mutual aid groups, local clinics, and financial assistance programs. And we'll share some ways to find some of those on our website.
Yes, and please remember this. We're not stuck in this broken system. We have the power to fight for change. So let's fight for a better healthcare system for everyone.
Let's do it. That's about it for this episode. We hope it was informative.
As always, you can check out our website, handballcourtradio.com. There, if you appreciate the work we do, you can donate to help us cover our operating costs. Also, you can follow us on Blue Sky at Handball Court Radio, and you can follow me there at Sarah Livings-Walsh.
I'm there as Not Like Mona Lisa. If you're listening on Spotify or Apple Podcasts, don't forget to rate, review, and follow us. And if you're watching on YouTube, we'd love it if you like, subscribe, and share so you don't miss our content.
And with that, I'm Sarah Livings-Walsh.
I'm Analisa Venolia.
And this has been Revolution Report.